All right, so I'm going to give you my 2 favorite home care strategies for my patients with low back pain. The biggest thing I see is a lack of movement in the low back. So the first thing we always want to start with is clearing up joint space in the lowest part of the lumbar spine, which is just above the pelvis and the sacrum. And for this, I'm going to use this foamy here. You can also use an outdated textbook. But basically what we want to do is create a bit of space between the pelvis and the ground. And so I'm going to use a chair, and I'm just going to position myself with my legs up on the chair, and then I'm going to take my foamy and just put it under the base of my pelvis, so that now there's a bit of space in between my pelvis and the ground, which is to create room for my lumbar spine. And so when I do this, I can contract the stuff on the front of my body as I go to lift up. Hopefully you can see that my back rounds down into the ground. And then I'm going to contract the stuff on the back by pushing my heels down into the chair. And here you should be able to see my back arch up. And so I'm just going to give it a bit of a hold. Let's say something easy to remember, 30 seconds. And then I'm going to go back down. I'm going to contract the stuff on the front, rounding my back so my heels are actually off the chair here. Again, a nice 30-second hold. And I'm just going to cycle between those two things. The reason why my pelvis is sitting on a block is so that I can create a bit of space for my lumbar spine to move. And I'm going faster than 30 seconds just for video purposes. Try that and see if it doesn't help your low back create a little bit of joint space. The second thing I like to do, now that we've freed up joint space, is deal with the tight musculature in your low back. So here, I'm going to use a technique which involves a ball. I recommend a tennis ball over lacrosse ball, just because the tennis ball has a bit more give to it. This is called iso ramping. And here the technique is I'm going to place the ball that's on the tissue that's extra tight, and I'm going to contract and relax the tissue with the ball's feedback to help me loosen up that muscle. So here I'm going to lay flat. I'm going to place the ball just between where the spine goes and the pelvic brim. There's a bit of a notch there. I'm going to ease into this because if I have tight muscle in my back, it's going to hurt. So first thing I'm going to do is just breathe. Just relaxing into the muscle. Now you're going to perform your own trigger point therapy by contracting the stuff on the front. You're going to contract that, which is going to push your back down into the ball. So that's your trigger point release. And if you're getting any zapping down your leg, you're sitting on a nerve, in which case you want to move the ball to a different location. And then I'm going to activate the muscle by arching up off the ball, holding, and then I'm going to relax down into the ball again. I'm going to cycle through that. So I'm going to contract the stuff on the front. That pushes my tight tissue into the ball. A little bit of release here. And then I'm going to activate that tissue by arching up off the ball, squeezing my back muscles. And I'm going to run through that a couple times just to get the muscle tissue to release a little bit. So first things first, create some joint space, then work on the muscle tissue. And I give that to every patient of mine who comes in with low back stiffness or tightness. They all get the same thing. So try that. Let me know what you think.